So this is what I was telling you about before we went to break. Emergency rooms across the country are seeing a sharp spike in tick bite cases right now. With outdoor activities in full swing, July is shaping up to be the worst month that we've seen in nearly a decade. That's according to the CDC. Now, the Northeast is getting hit particularly hardest right now, and doctors say the most vulnerable are kids and seniors. They're bearing the brunt. Tick bites can transmit serious illnesses like Lyme disease. Symptoms often mimic the flu: fever, chills, fatigue, muscle aches, in some cases rashes too, you name it. Joining us now is Dr. Omer Awan, a physician and public health expert. Dr. Awan, thanks as always for being here this morning. Appreciate it.
Yeah, my pleasure. Thanks for having me, Markie.
I mean, July has already broken a record for the month with most tick bites since 2017. And might I add, it's July 10th right now, so we still have most of the month left. How concerned should we be by this, and what's contributing to this trend?
Oh, we should absolutely be very concerned because tick bites are increasing significantly, particularly within the last 8 years, the most, I think, since 2017, based on the CDC record. But what's driving this is predominantly climate change. Warmer temperatures, and ticks thrive in warmer temperatures. And now that we have milder winters, that means that ticks are less likely to die off in the winter, and they can survive and be active for much longer. And the other aspect of this is it's not that they're just active for longer periods of time. They're also able to go to different geographic areas that we've never seen before. So, for example, you take a look at Lyme disease. Lyme disease has traditionally been in the Northeast, but now we're seeing it in areas where we've never seen it before, places like southern Canada, even Minnesota, Maine, upstate New York. So this is obviously a very concerning trend.
Yeah, I have a friend who has Lyme disease, and it's just horrendous to watch. I grew up in Texas and Oklahoma, and oftentimes you'd come in from playing outside all day, you'd have a tick on you. You'd put a hot match on it or nail polish, which I feel sure is not the way to, to fix the problem. But then you kind of just, called it a day and went on. I feel like there's so much more alarm now around it. Is that because there's more information out there? Have ticks become more disease prone too as the years have gone on?
Well, definitely there's more information, there's more awareness in the general public, and that's why we talk about it more, and that's why we're here talking about it. But also, yes, they can have very serious diseases. Now, the majority of ticks are not will not cause illness, but there are a handful that definitely will. And, as you said, it can lead to, very important and sometimes serious symptoms, things like fever, headache, chills, muscle aches, for example. But for some, like that have Lyme disease, it can even result in very serious complications like heart block, which is, something that can potentially be devastating and even life-threatening. So definitely something to look out for, and for us to be vigilant about, looking for ticks carefully.
Yeah, and if and when we find a tick on us or our kids or our pets, what should our immediate next steps be, doctor?
Well, obviously, there's several things that you can do. One is to avoid areas where ticks usually live, things like wooded, brushy, grassy areas. Obviously, if you're an outdoorsy type of person and you like to hike, making sure that you hike on the center of the trail and not along the periphery, because if you're on the periphery, that's usually around grassy areas where they're likely to bite you. Making sure that you wear long sleeve clothing, things like, long sleeve shirts, long sleeve pants, using insect repellents that contain DEET or picaridin, and then also, applying permethrin cream on your clothes that can repel ticks. But maybe the most important thing, Markie, is, just doing tick checks on your loved ones, after they come back from being outdoors, scrutinizing their body, their back, their legs, their scalp, making sure that you don't see a tick. That can significantly decrease your chances of getting bit by a tick.
Yeah. And if you think you have been bit, should you go to the doctor or ER immediately, or do you wait for possible symptoms? What's your guidance there?
Well, you should take action immediately, whether that means going to the ED, that's fine. But also, if you have somebody there that can, put gloves on, get tweezers and, remove the tick, that's also fine. So if you feel comfortable doing that, you absolutely can do that. But, if you should probably go to the ED if you have any questions or concerns.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.